Welcome to Global Health Diplomacy. I'm Julie Fisher.
And I'm Rebecca Katz.
And we're going to introduce you to the topic of global health diplomacy and to our course objectives. But first, we'd like to tell you a little bit about ourselves. I'm a microbiologist by training. My doctorate is in microbiology and immunology. And after a career at the laboratory bench, I became involved in global health actions in building capacities to detect and report disease events like outbreaks in the public health space. After that, I came to George Washington University, to the Milken Institute School of Public Health, where I co-direct a portfolio of research projects that look at what's needed to achieve those capacities to detect, report, respond to disease events, from the largest policy framework down to the specific questions of what materials, equipment, people, and financial resources are needed in the field.
So I am an associate professor at the Milken Institute School of Public Health at the George Washington University. And as Julie mentioned, we've been co-directing this program on global health security and diplomacy for a number of years now. And while Julie comes from a very technical lab background, my background is more in social sciences and epidemiology and demography. And we've been able to merge our backgrounds to, as Julie mentioned, focus on issues of how countries around the world think about the policies and the tools, the knowledge, the infrastructure to be able to address public health emergencies in a sufficient manner. And for the last 10 years, I've been a public health consultant to the U.S. Department of State, where I've had the opportunity to work on some of the more core diplomatic issues in global health, and hope that been able to bring those experiences to this course.
And collectively, our experiences in those formal negotiations and in the informal interactions in the field that constitute the backbone of so many public health actions helped inspire us to create this course. We've learned through meeting with professionals who have made global health diplomacy their career and who have carried out some of the world's most effective public health interventions, that there are many lessons that they've learned about negotiations, about agreements, and about how those are shaped in action, often through the school of hard knocks. So our goal is to distill these experiences into lessons that you can use in your own careers to think about how global health diplomacy practices apply to you and your work.
So the purpose of this course is to first introduce to you the concepts of global health diplomacy. What are we even talking about here? We also want to be able to provide some historical case studies so you can understand how diplomacy has been used both to advance health and how health has been used to advance diplomacy. We'll also explore what it means to actually be a health diplomat and what that career trajectory looks like and what are the skills and knowledge that are required. And then we're going to try to challenge you to learn how to read and interpret the text of health agreements, to become a negotiator yourself, and to try to assess the policy context.
And to do that, we'll be addressing a number of course objectives. We're going to begin with definitions, making sure that we all agree on the terms we're using for the different types of health diplomacy and the different actions and forums in which health agreements may be negotiated. We're going to illustrate this through a number of concrete examples of how countries have used health diplomacy as a tool in the past to achieve their own national interests. We're going to better understand the skills. What are the skills and the tools and the knowledge that global health diplomats need to be able to work in the field as well as in a formal negotiation agreement? We're going to describe the challenges and the opportunities as well for collaborative global health interaction between institutions, among organizations, between nations, and among international stakeholders, to discuss how that not only provides a framework in which global health activities can take place, but how those agreements themselves shape diplomacy and the understanding of what we expect out of global health engagements, both now and looking forward.
So we look forward to working with all of you over the course of the next 10 weeks as we explore this world of global health diplomacy.
We think it's going to be fun, and we're really looking forward to learning with you.